Younger Canadians have higher odds of spending more time in the sun and using less protective measures than any other age group across the country. Those are the findings in a study in the peer-reviewed journal BMJ Public Health. The data highlights disparities in sun-safe behaviors across different age groups. It finds 18 to 29-year-olds are less likely to use physical protection like hats or pants and more likely to use tanning beds and burn. Amy Roswold spends her time educating people about sun safety. She's the Director of Marketing at Save Your Skin. Amy, first of all, thanks for being here. Any of that surprising to you?
No, I think we've always struggled to reach a younger demographic, and I think a big part of that is that the messaging we usually use about being sun safe just doesn't necessarily resonate with their priorities or their perceptions of risk. I think 29 or 18 to 29-year-olds just don't feel that vulnerable to skin cancer. It seems probably like something far off, like an older person's issue.
Before we get to some of those issues, tell us about some of the different messaging campaigns you have tried.
Well, May is melanoma month, so every year we really shift into high gear around that time. And this year we really wanted to focus on prevention, partly because of the crisis we're facing in primary care. And for dermatologists, at the moment, there's only 800 dermatologists for all 40 million Canadians. So while early detection is really important, just preventing skin cancer in the first place is really a top priority. So some of the ways we do that is we have an initiative called Shining a Light on Sun Safety that is specifically for children and caregivers, especially in schools, camps, daycares. And the idea is to kind of spark early awareness of sun safety and build lifelong sun safe habits that will become kind of part of their daily routine going on. We also partner with municipalities and provinces across the country to proclaim May as Melanoma Month and offer sun-safe resources to them and to share with their communities. And we offer free public sunscreen dispensers across the country. We have 5 in Vancouver this year, with about a half a dozen more pending.
Beyond this study from BMJ Public Health, have you seen other tangible evidence that younger people are not getting the sun safety messages and why you think that might be?
Absolutely. There's misinformation on social media. We've seen lots of myths about sunscreen, being harmful, myths about base tans on social media. So we try to debunk those myths. And also anecdotally, we see more younger people coming to our foundation. We see people in their 30s, young moms and dads with melanoma. We've even seen people in their mid-20s. Come to us with melanoma. So, we know that the sun damage they're accumulating over their childhood and their teen years does have really serious consequences.
We also know the study also shows lower income groups are using sunscreen less often. Is that something that you're hearing from the people that you chat with?
Certainly. We all know how expensive everything has gotten. It's pretty rare to find a bottle of sunscreen for less than $12, $15, even more if you want something more kind of lightweight for your face. We've been approached by shelters for low-income communities asking for sunscreen donations, which we oblige whenever we have them. And that's one of the reasons that we do offer our free public sunscreen dispensers, because if you're on a fixed income and your priority is food and rent, then sunscreen does become a luxury.
Amy Roswold with Save Your Skin, we appreciate your time and your expertise. Thanks for joining us.
Thanks for having me.